Are there any skill sets pertinent to being a successful teleradiologist that are not currently taught in radiology residency or fellowship programs?
Well, there isn't too much difference in my mind between teleradiology and on-site radiology, at least in terms of the execution of the actual job. You do learn to read a little more into a little less information, perhaps, and you may have a broader potential differential in mind for any given study because, again, you're just one step remote from the whole process. So I always told our teleradiologists, why do you need a clinical history at all? Just assume that every study is a patient who's been in a car wreck, has a fever, and has a history of metastatic cancer. And then you'll be fine. So that's the one difference, I think, for teleradiology. In general, I wish I saw more emphasis in both on-site and teleradiology on the utilization of a search pattern to interpret radiologic studies. I think that some people are exposed to it, but it is not a universal component of people's educations. And I can tell you that after, I think I was on the vRad QA committee for about 12 years, and after looking at all those QA cases, I came away convinced that about 90% of all radiology errors result directly from failure to adhere to a regimented, methodical, repeatable search pattern for that procedure.
You know, Ben, I couldn't agree more with that. Being in academics, I often talk to residents before they start call. They are always nervous. And the advice I always tell them is that the best thing you can do to be prepared for call is to have a solid search pattern. I tell them that the misses you will make will likely not be due to a knowledge gap, but it will simply be that you didn't look for that finding, and that the end of maybe a year on call, you will find that your search patterns have really been solidified. I do think that an emphasis on search patterns is something we should probably focus on more in residency training, at least at the programs I've been at and taught at. And I really appreciate your perspective there because I couldn't agree more.
That's great to hear, Matt. You're giving good advice. I'll throw in a book recommendation, Atul Gawande's Checklist Manifesto. It doesn't actually address radiology, but it seems like it does. It will speak directly to you and to this issue. It's an impressive work. I really encourage people to read that book and to apply what it says to radiology. The simple fact is a complex cognitive task, such as reading a CT scan, just requires a regimented approach. I often joked, one of my old chest attendings told me once, the best distance to read a chest x-ray from is you reach out and touch the film, and then you lean back and put your hands behind your head. And that's how you could determine the perfect distance from which to read a chest x-ray. If all you did was read one view chest x-rays, you could, after 20, 30 years of it, you could just let that image kind of flow over you and passively take it in and do probably fairly well. But the complexity of modern imaging just does not lend itself to that sort of approach, right? When you think about misses today, you will miss something if you don't have the right image up, if you are not scrolling at the proper speed, if you don't have the right window setting, and if you don't have the right thought in your head, for that matter, you will miss that finding. And so I think the complexity of imaging has created a need for greater emphasis on that approach, that being the search pattern approach.